I think each of the three groups has identified somebody to make the presentation. So can we start with group one? I guess the group one is the one that said? Yeah. Group one was, what should we be investing in? So we have to be very, very disciplined about time, because if we want the lunch at 1 o'clock, we have only 45 minutes. And what we plan to do is, for each group, there are three groups, for each group we are going to give 15 minutes, 5 minutes strictly for the presentation, where only the key issues need to be presented that have emerged from the group discussion, and then 10 minutes for reactions. Is that okay? Yeah. So we will start with group one. Are you presenting? Yeah, please do.
Hello, everyone. Again, my name is Vesna Kotlasik, and I am speaking on behalf of What Should We Invest In, which was group number one. And I have the least amount of time to prepare, so I apologize if I overlook some important points, but I'm sure our group members will remind me of anything that I missed. This one? Is this one better? Okay, sorry. So our group had What Should We Invest In as the topic. And I'm going to hit the highlights. We had a very lively discussion, and I appreciate all of our group members' very helpful input. And I would say that we really echoed a lot of the important points that have been made by our presenters over these last couple of days. So our group had a lot of agreement and also elaboration on some points that were made that are very specific to issues that are happening in India and other places in Africa as well. I think we had some converging themes that came up. And one theme that was very strong was advocacy and awareness raising at all different levels. There is a very strong message about not forgetting the grassroots level. Oftentimes we think about top-down, from the government down, and a more centralized approach, but people felt very strongly that there needs to be at a community level input from starting with the child. Do we ask children what it is that they want? And I know from my past life with UNICEF, I always found the input from the children to be very real and very informed, actually. We often underestimate children's experience of their education and of their learning, and they often give us good tips, and we forget to ask them sometimes because we're trying so hard to help them. But then also the other issue is then, if we're working with the child, what is the involvement of the family? Are they also, with the child, getting some type of exposure to education, training, capacity building? Capacity building was a theme that kept coming up at all different levels, and so we were really thinking systemically as a group. We weren't just focusing on the child or just one aspect of the system. We were really thinking about how these different pieces come together. So thinking about how to incorporate parents was also important, and we know that mothers are important, and a lot of times culturally they're the emphasis and they have the responsibility for childcare. But people also felt that fathers should not be excluded, and that people are parents and grandparents, and we need to have ownership of some of these issues and be more active in identifying solutions. We also had an interesting idea that I've seen work well, actually, with UNICEF as well. Someone said, we need a celebrity to make this exciting for the population. Sometimes there are other causes that identify a celebrity with that particular issue, and it gets the whole population excited because of the popularity of the celebrity. Oftentimes I've seen that done with sports players or a popular actor or actress, and you may know for the U.S., Angelina Jolie is a strong advocate, and people get excited when they come to Congress. Even all the Parliament, Congress people run to see, Brad Pitt or Angelina Jolie in Washington. So I think it might be like that in other places as well. I've mentioned the capacity building, and people mentioned as well, what about our local leaders? They make decisions about resources that are available to a lot of the child development centers, and sometimes when they're aware of what's needed, they might be more willing to bring those resources together, and they have sometimes the most ability to do so, but they're not part of the conversation. We also talked about capacity building of frontline workers as well, and all the way up the system, and training and continuing education, not just training once, but recognizing that people are growing throughout their career and they may need some additional skills as time goes on. There was also, of course, a strong emphasis on governance and accountability, how to improve systems, and transparency of where the money is going. We've had that theme quite a bit with our meeting these last couple of days. And also data sharing. How do we bring information to different centers or different components within the system that are doing well? How do we learn from each other's examples? Is it possible to make a network across these different centers to bring the information together more easily? We also talked about the mobilization of resources, informing families and communities how to use resources, educating them about what's available and how to advocate for themselves and their children, monitoring and evaluation of programs, looking at research of outcomes, intervention research as well, monitoring what is happening in a more systematic way, and dissemination. You know, sometimes there is information that's gathered and it stays in the government and the population doesn't learn about it. Key professionals who should know about those outcomes don't learn about it. So what is the mechanism of getting research that is conducted to the relevant individuals in the system that should know about that to do their jobs more efficiently? Also, vulnerability and vulnerable groups was important and emphasized. Women's issues, involvement of men, as I mentioned, and developmental disabilities. There is a strong emphasis that we really need to give that more attention. And I think actually I'm out of time, and those are the highlights that I would emphasize. So if there's anything else, I'll leave it to my group members to remind me of something I may have missed. Thank you.
Thank you very much for really keeping to the time. Maybe we could have some comments. You can't hear in the back? Comments, suggestions to add on to the list? No, I'm inviting comments or suggestions to add on to her list. Yeah. The issue was, what should we invest in? That was the issue.
I was just wondering if we could include improving the remunerations that the ECCE workers get. It would greatly improve their own self-esteem and the desire to invest more in the work that they are doing.
I've worked with the NSS consumption expenditure surveys and realized that we have variables available in that for the PDS. So it is easy to analyze what's going on in the public distribution system, but we don't have similar variables for the ICDS, whereas they're also very responsible for delivering a lot of food to these households. And there's also this new mystery that there's a calorie decline going on. And FAO says that it might just be a statistical artifact because they're not capturing enough. So one low-cost investment might just be to put in a few variables of what the ICDS actually gives these households and what gets to them and how much of it they actually eat.
Any more ideas? Yeah.
Didn't say it all in the first time. I'm not sure if we have, Dr. Kaul, do we have quality indicators for ECC for our country?
We don't have, there is something on, it is subsequent to the national policy, but it is still to be
worked out. So probably
finalized.
that is where again I think we need to invest.
Yeah.
Did not come out in the group, but I'm thinking of it right now. And one thing that came up was protocols, but I think there's the how-to. Because within the outcomes, we were thinking there's going to be different, we need to define them according to age and the needs and the donors, as well as the geographical differences. But beyond India, even the different country differences. And so rather than just develop protocols, maybe the how-to of how do you prioritize an essential package of VCD services for your particular context.
Anyone else? Yeah.
ECD, ECE, and childcare. There's so much transdisciplinary and interdisciplinary inputs in it. So we talk of nutrition, we talk of the brain, we talk of developmental disabilities. Yet what I find is there is little actual on-the-ground collaboration between health, social welfare, and education, and of course economics. So I think some meetings with people who are in the field, particularly like pediatricians, child development specialists, and bringing them together to have these courses where you can actually talk about real child development and childhood education as interlinked is extremely important, and I find that lacking in our country. So some investments in those areas might be helpful.
You're talking about an interdisciplinary dialogue, right? Anyone else? Everybody's spent out after that group discussion? No? So we can move on to the next one. Thank you so much. So those points have been taken. I think one of the very strong messages coming through from this group is the need for environment building. And I think I fully subscribe to that, because I just want to share on the side that, for example, we had the iCDS. It has got 6 services, primarily nutrition, health, and education. And it is sometimes very interesting to know that even ministers and bureaucrats don't know that early childhood education is part of iCDS, leave alone the parents, So that is one of the things that is very important, creating awareness. Can we have group 2, please? You're group 3 perhaps, no? Both of you are doing it? Okay. So this group is?
Well, I think our question seems very simple. What needs to be included in cost models? Okay. But it is not simple as it sounds actually, when we're discussing in groups. So several interesting ideas and, several dimensions that I realized actually, when noting down quickly the points. My group members, I really urge them to add if I miss some points, because at the end only I volunteer, to really present it, whatever I have noted down here. Well, I think the philosophical questions is that which goal are we heading for actually? Do we need to really set a goal actually before when we venture into the ECD program, For example, it was very nice to see from Tamil Nadu experience that the government wants a malnutrition-free state. So maybe that helps to really develop the costing, from that kind of goal. What we want from the early childhood development, and what are the competencies of the children, from ECD that we are aiming for. How to address the behavioral issue of the parents and the caregivers in terms of, especially from 0 to 3, when we talk about what are the value statement, and finding interventions and cost for the outcome that we want to achieve. These are some important issues, and what we are aiming for, how to address the learning, the different learning needs and different learning capacity, of the children. So this is quite complicated, in fact, when we are thinking of the cost, because different children, they have the different capacities also in terms of learning, So the question that we also talked about, whom are we costing for, and why do we cost for government so that government say we cannot afford it and raise funds? So these kind of questions were really very, very interesting in our group discussion. In general, in terms of the cost modules, we came up with the following points that, of course, it is marketing as well. For example, I was looking for the Save the Children website, and it says that we can be the reason behind the smile of every child. You see, I mean, these are some issues in relation to the marketing that we should keep it in mind. Development cost, is it for the piloting that we are costing, or is it for the overall development that we are talking here? It could be different. See, then in the cost module, do we have some minimum standards? I think we should think of these minimum standards for the ECD programs while we are costing. And maybe we should start with specifying the outcome and interest. And as I said earlier also, the learning need and capacity of the different children into the costing modules. And there were a very interesting experience was shared also, that which interventions are we talking? Is it community or center-based interventions? Also, the costing, it includes the parents' time. So parental time should also be considered when we are costing, we realize that in terms of interventions, it doesn't take really long years, maybe not like 20 years. I mean, we can see immediate benefits if we have a good model of costing. This is what also we talk into our group. And the community-based, when we talk about monitoring, I think the community should be involved. Our costing should be as such that community-based monitoring should also be part of the costing. And the most important issue was that the analysis of the costing structures. We should keep it in mind, has there been analysis of the costing structure or not? It is also in relation to inclusive activity based, for early childhood education and development. ECD being a very multi-faceted issue, we can save lots of cost, through sitting together, education, health, nutrition. There was one example, for example, the media mobilizations that we put as our costing. That could be, minimized when if we work in a kind of convergence approach. I think, we talked about quantifying the outcomes, and also we talk about, the fundamental question was that what is the population is in need actually, that we are aiming for, and what is the overall population, and what population are we really planning, when costing. So this is something that we should keep it in mind. So my time is out. Thank you very much. Maybe group members can add further if there is anything else.
Thank you.
Thank
Please
you.
join me. Yeah.
Thank you.
Any suggestions, comments? Yeah.
Yeah, I think I can just add a few things which you've actually presented very well, and just a few more points that were brought out in the group discussion. One is the question started off, are we trying to just find out the cost of scaling up, cost benefits, cost efficiency, what is it that we are trying to address? So then we kind of narrowed down to the fact that we just want to discuss here the costs of actually implementing either the headline statement, as he said, for zero malnutrition, or is it the cost for the program that we are talking about, the cost for the projects that we are implementing, or cost for getting a particular outcome. So these are the things that we kind of started off with discussing in the thing. Then once we started talking about, that it will be the program cost, or that we need to talk about, there we thought of two basic areas. One is the intervention cost, and one would be the total overall program cost. Under the intervention cost, then again it was dependent on the priorities that we are talking about, upon the population that he just mentioned that we are targeting, disadvantaged, gender, specific needs, or whatever it is. Then for the intervention cost, there were examples that were given that, those are basically directing to the child, so the cost would have to include the salaries of the human resources that are being included and the supplies, whether it's consumable or non-consumables. Under the overall program cost, we had to think of things like administration, supervision, training and capacity building, advocacy, community awareness, infrastructure, repairs and maintenance, monitoring and evaluation, communications, operational costs such as electricity, water, etc. to run a particular program, travel costs, and so on. There's a big list. The other point that was actually talked about is in terms of the boundaries. We have to be very careful what boundaries that we want to define in terms of cost, because you can go all over the place when we are costing. As we were talking earlier also, is it the opportunity cost of the mother's time? Should that be included as the part of the cost? How do you actually cost that? Is it like, the salaries that she's foregoing, or what is it? Then we also talked about research costs. Should those be a part, included, excluded kind of a thing? Or should we talk about costs for like the fixed costs that the government already has certain setups, and whether those should be included or not included. So those are the kind of areas, I think, besides some of the things that my colleagues has already talked about, and I'm happy if other people would add. Just one thing I want to mention here. For health sector and nutrition, we've been using something called the UN One Health Costing Tool. And I did not find anyone in my group who was aware of that. It's a very useful tool to do costing exercises once you have a particular program or project, which I've been using quite intensively. Thank you.
Thank you. Anyone else? Yeah. Cost of inaction.
Yeah, I think Chris laid it yesterday very beautifully. I think that's one big item we should include, because the more we delay, the more expensive it becomes.
The people who I think, Kimber, you should be happy. The message has reached. Yeah. Yep.
Thank you. This question is more a little bit to the forum, because if we look at the proceedings from the cost of inaction in April and the presentations by Jerry, Constanza and Quinton that covered that area, and then listening to the working group discussion today, it sort of moved it a couple of steps forward. That conversation was around what data is there, what programs are there, what have we costed. This discussion started to break it out into the technical pieces of really what are the items to cost, and also the bigger overarching issues of why. So it's almost like this costing theme is starting to grow, and if there was a way for the forum to pick up and start to grow it, it would be a good sort of storyline to take forward. So less of a question, sorry, more just an idea.
No, comments, questions, both are welcome. Nobody else? Yeah.
In for the floor, or for the group actually as well, which is, and it wasn't in that session, so I don't know if it was covered, but would be very interested to know if, and please come and find me afterwards, the data and research that's been done into the trade-offs that are made when you're costing assessment and assessment to quality. And because there's obviously a light touch quality assessment, and there's extremely high touch, and I'd be very interested with anyone in the room who's got data on what are the trade-offs and the different costs of different approaches.
No one else? I would just like to add one point, which I think is already there, but this was somebody mentioned this yesterday, which sort of stayed in my mind, about the cost of outcomes versus cost of inputs or outputs. Particularly the fact that when you're talking of outcomes, and if we're talking about the marginalized, the costs have to be much more than for a more better off clientele. So I think that point was very good, which I thought we need to be incorporating into this. Yeah, Pratibha.
Because all over the world, I mean, number of studies have been done, meta-analysis have been done, systematic reviews have been done, and it has been clearly demonstrated that the effect of early intervention is maximum with the marginalized group and the so-called at-risk children. And therefore, I mean, if one has to deal with, cost effectivity, then that's the group that needs to be addressed most. And the other issue is about sustaining the effects of intervention. Again, it has been shown that small-scale, high-resource programs give much more effective outcomes as compared to wide, low-input programs. Even with that, with all those Head Start programs, etc., sustainability decreases as time passes, and therefore an ongoing intervention is needed, particularly with the marginalized group. So all that needs to be counted in.
Yeah.
I mean, maybe this has been said already, but the last two interventions make me think that to some extent, even though there's a cost of inaction and there's a big picture cost and so on, I mean, from a policy point of view, we don't really care. Because at least in the short term, we are talking about marginal gains and marginal investments. But what we need actually is the cost-benefit ratio. And the fact that we have a higher marginal cost, we didn't mention that too much, of reaching the poor in remote areas and other places, but also a higher marginal gain. I guess actually from the literature, the ratio of proportionality between the marginal cost and the marginal gains is different, with the marginal gains being actually much larger than the marginal costs. And so even though you have a higher marginal cost, you have a higher and much higher marginal gain. And I don't know if people actually have put that together, because that's actually the only argument that you can use to convince somebody to pay for the higher marginal cost. So this is something that we should perhaps try to put together.
Thank you. Yes, the back.
I was just wondering how one can factor the costs of leakage. I mean, first of all, it's very difficult because you don't have clear and direct evidence, but then there is this overwhelming feeling that there is corruption, there is mismanagement of funds. So for every 100 rupees that you spend, if 30 or 40 is actually not being utilized for the services that were meant, so then the cost, it's a hidden kind of cost that we are not probably factoring into everything else that we're doing. So unless we find a way of doing that, then all the cost analysis will be very, it will be incomplete without looking at leakage, issues related to governance, and in a very gross sense, corruption, people who are making money, siphoning off either the ready-to-eat food, selling it in the market, or making money through other means in the system. So I think that's something that we need to really think about seriously.
So thank you very much. Now we got those ones?
Yeah.
So now we can invite group 3, convergence. Yeah, please.
Thank you.
Great. So I am representing the group that discussed how do we converge funds to have an impact. And very quickly, this went beyond just money. That's obviously an important input, but recognition that there was a lot more that we were talking about. And so you'll excuse me if that's probably the last time that I mention kind of dollars around that. And I think we had a great metaphor that came out from the conversation about like what is actually the challenge that we're facing here, and this idea that we've essentially got different players involved. This is a multi-sectoral area, as we've recognized several times already in the last few days. And we need these different sectors involved in order to have the impacts that we're really looking for kids. But the problem is that we've got, if you think about these different sectors, kind of building a bridge, starting at different sides of the river, but they're actually not meeting in the middle. And so it's this idea of how do we make sure that we've got some kind of common vision, and we're actually, with all the efforts going in and resources and things, that we're actually having something that is strong and able to actually support what we're doing in the end. So with that, we zoned in on a few different levels. This won't come as a shock to anyone, I don't believe, but just to make them explicit. The first was essentially this top-down, this political will that is so necessary in order for things to move. And the second is the bottom-up, so the grassroots, talking both at the implementers kind of level, the frontline workers, as well as with the parents being involved. And I thought one of the things that was most interesting that came out of this was very quickly also move to these ideas of having some success models that are out there. We had some very specific reactions against wanting to do more kind of case studies or examples of best practices out of this. But I think it is important to pay attention to these bright spots that are coming out. We had 3 that were put on the table from different states in India, being Kerala, Tamil Nadu, and West Bengal. And I will let my colleagues speak to that more. But the main thing I got out of that was essentially, depending on how the structure of the governance, the decision making, and the flow of funds happens, that it may make more sense to go higher up the chain to make sure that there's kind of shared vision there that can go down and be communicated down, or it may make more sense to focus on the ground level, and that both can work, but it just depends on what the structure you're dealing with is. And I think there was also some interesting another interesting model that came up from our colleague from the mobile creches that was talking about the ability to engage parents directly to essentially provide an accountability mechanism back into the system, which I thought was worth mentioning to the wider forum. And then there was also a few examples of ideas where we're taking the evidence that we've recognized there is a quite robust body of evidence that's out there, that we're not yet using to the full benefit, and that there's been a few examples of where this has been first translated into kind of a common story, and then also successfully communicated to decision makers. This has happened in the US, this has happened in Brazil. Eduardo gave us a little example of that, and I'm also familiar of another example in Canada in one of the provinces. And this idea of really recognizing that there's lots of people at stake, there's lots of people who are making decisions every day, and essentially what you're wanting to do is to try and make sure that those decisions are as aligned as possible towards a certain common vision, a common outcome, this being kind of a support of healthy development for kids. And that I think these models of engagement and translation and making sure that we're, that the decision makers out there, and not just one person, but essentially a critical mass of them, so that if there's shifting in things within the political system, which is always going to happen, that we've actually got kind of some backup, and there can be some continuity around this. So that was the main points that I heard, and essentially that idea of we've recognized these kind of key stakeholders we need to engage, and I think that's nothing new, but I think starting to zone in on some of the models that have been successful in different contexts might be a productive path forward for us. So I'll leave it at that, but happy to invite my other colleagues from that group to
Thank you.
Input.
Yeah. The key issue is how do we create political will? No?
Yeah, I mean, a few thoughts which struck me afresh right now, like the lady in black, and 1 or 2 additions to what you said. The thought which struck me afresh first, that's what I'll say. I think we've spoken over the 2 days on convergence, and we've spoken about different ministries and health, nutrition, education, except for a fleeting thing yesterday. I think we don't mention children with the special needs. It's somehow implicitly understood, but I think we need to explicitly state it before it gets really internalized. For example, one of the things which I notice is that in many of our conferences which we do not have people from the Ministry of Social Justice and Empowerment, which is the one which looks after, the sector of disability. So
incidentally, they were invited for this meeting.
Oh, so they didn't come. Okay. So, I mean, but see, then that's a gap where, that's what I mean. So, I feel that we need to be a little bit more vocal about getting convergence with the the ministries or the sectors which deal with disabled children. One of the things which came up in our thing was, many of us were quite enthusiastic about the Bihar model which Amarjit ji had, sort of said, and we felt that this cabinet committee which sort of was made did not belong to any one particular ministry, and that was perhaps its greatest strength in having achieved convergence. And we did feel that if this sort of a thing could be possible across states, and supported also by that this committee should not be something which forces its own model of convergence upon the grassroots people. So it should work in tandem with the grassroots. That's how we felt that the linking up between the top and the bottom. And one little thing, an idea which just occurred to me just now, maybe we also need to describe what convergence means at different levels. So for at the top, if it means interministerial or interdepartmental convergence, at the grassroots it might be, meaning something else, in the sense that here we want to converge on a particular group of beneficiaries. So convergence here is from the perspective of the person who is receiving the benefits. So because we did an evaluation of a program and we found that a 2-day training to mothers to look after their children, and then moving on from one group of mothers to another, and never coming back to this mother, sort of has no meaning. So you needed to sort of converge on this mother for an adequate length of time. So could we, sort of look at what convergence means for different stakeholders? It may mean different things.
Thank you. Yes.
Another thing which we spoke about in the group was involving the parents and realizing the input that they could have, and also skill building of parents could be a part of the convergence. So convergence to the child has to include the parents as well.
Yes.
Another view of converging could be a lot of good work happening in different pockets across the country, across different states, and to that extent happening only to that particular community or that particular area. So convergence of these small good models which are actually working in the country could be a point, could be a forum where they could come together, share, and then maybe one is sharing the best practices, definitely, but the model could be blown up if that whole convergence happens. So it's convergence not just from a silo point of view, but a convergence of different units, different NGOs, organizations which are working and doing some great work at different pockets.
Anyone else? Amarjit, would you like to say something on this, what did you call it, committee that has taken everybody with interest? Huh? No, we'll give you half a minute to speak about this.
No, I think
what does it take to have that?
The group rapporteur has captured the issues very well. That there are these elements. Convergence ultimately has to be seen in outcomes, and for it to be seen in outcomes, it has to happen at the local level, where a child is not fragmented. The child is seen as a whole, and at the same time there is a clear steer from above politically, and what we call political will, if you break it up into activities, it actually amounts to saying, convincing those who take decisions that this is the right thing to do. And I think this is where perhaps we are failing. Our failure is our inability to make them take the decision that we want. And clearly convergence is one idea whose time has always been there. Everybody has been for it. But in actually translating it into action, because what it necessitates is a change of relationship of departments, of people, of leaders. So clearly nobody wants to lose a position. I mean, let's be very, very frank. The problem of convergence is a problem of every department having its own space and not willing to look at the others. So the moment the child as a whole is the subject or the key reason for all the interventions, convergence will start happening. I think that is really the message. Thanks.
Yeah, I just want to follow up on that. He said all the departments want to limit to their own turf. It doesn't happen only with the departments. It also happens with the good practices that he's talking about the NGOs. It also happens, Quentin, you will say, in the World Bank. So I'm not supposed to say that. I'm out of the World Bank, so I can say that. So it happens everywhere, you know. And that is because I'll just take iCGS as a very good example of lack of convergence, because there are 6 services. So and outcomes are kind of defined. But you see, there will be iCDS projects in nutrition, there will be iCDS projects in early childhood education, and there will be iCDS projects perhaps in health. So these, I think it's a big challenge to break these silos. Yeah, somebody.
I think we also need to think about convergence in policy, convergence in program, and convergence in operation level. Maybe we are talking a little bit more of convergence at operation level here. Perhaps it is very important that we have a very converged policy as well for early childhood development. I mean, for example, if one ministry or one sector takes to implement the converged policy, that may not work, you know. For example, I'm giving an example of Nepal. Under the Ministry of Education, we have a national ECD guideline, okay? That has a provision of a district ECD committee, a multi-sectoral committee whereby different agencies are invited to sit together and discuss on the early childhood development and implement. But actually, the steering body is only the ministry at the district level, district education office. And the sectoral ministry doesn't have that authority actually, you know, to really make sure that other related agencies are taking part, and other related ministry agencies do not feel necessary because they are not under the Ministry of Education, you see. So that's how I see the problem related to the policy level convergence. Maybe at the national level we need some kind of body. I don't know whether it has to be under the executive level. For example, under the Prime Minister's office, we need a high-level body which really ensure steering the different sectors. You know, for example, under the office of the President, I mean, very high authority level, a body which really bring all the sectors together at the national level and also likewise at the district level to make sure that these different agencies are meeting together and working, you know, for the children issue. Yeah, thank you.
Yeah, last.
I would like to share 2 points. Like one is in some states there is an exclusive department called Center for Good Governance. I think the purpose with which it was started was to look at how the different departments are governing and how to look at even the convergent aspects of the working. But of course they are not in reality working, but this is one idea which can be like streamlined and strengthened to ensure this intersectoral convergence. And second, to add on to Mr. Amarjit Sinha, in some states there are some special initiatives where under the Chief Secretary the convergent forums are created. And they look at not only the conventional departments like women and child, health and education, they also look at the non-conventional departments like even tribal welfare, planning and the rural development, etc. But this is also what is happening is with the change of the leadership, the things are changing. So somewhere we need to look at like how do we make it as a system issue and not with the change of leadership everything will dilute or collapse. So we need to look at those issues also. Thank you.
Okay. Thank you very much. Okay, that was supposed to be the last comment. Is it a very burning comment? Please, last, absolutely the last.
Thank you very much. I will just make it very simple. I'm sharing one experience from Nepal. For nutrition, there is a plan, multi-sector nutrition plan developed by 6 ministries: health, agriculture, education, women and children, local governance and WAS together. So central level, they plan together. At the district level, they implement sectorally, but again at the district level, they review and monitor together. And then for sake of convergence, they have also prioritized the targeting. So the 1,000-day households were to prioritize, and the most disadvantaged districts or communities are prioritized. So every sector must go to those VDCs or households in the DAG community, plus the 1,000-day households. Every sector must go there, so that it has kind of, you know, made it compulsory for all sectors to go together and act together. So that may be something that, you know, that may be useful. Thank you.
Thank you very much. So We close the session.